15 days of total protein restriction, लौकी और भुया कभी खा के और जो काशी फल खा के, what will happen is यूरिया will come down to almost normal, 80 हो जाएगा. फिर कहेगा तो यूरिया करा के आओ, अरे देखो मैंने ट्रीट कर दिया, यूरिया इतना कम हो गया. So what will happen after few months, when that patient will become so weak and he will lose his muscle mass also. यानी जो मसल्स थी वो भी लाए हो गए, तो अब क्या होगा कि अब वो प्रैक्टिस जब कराया जाएगा तो 3.5 होगी. तो यार 8-9 प्रैक्टिस से मैंने 3-3.5 ले आया. पहले तो मैंने यूरिया कम किया, अब हमने आपका प्रैक्टिस भी कम कर दिया. अब देखिए आप कितने खुशकिस्मत हैं. अच्छा हाँ, यूरिया कम करने से थोड़े से यूरिक सिम्टम्स भी बेहतर हो जाते हैं, नौजिया वॉमिटिंग भी कम हो जाती है. लेकिन बैकग्राउंड में क्या चल रहा है, बंदा कमजोर होता जा रहा है, माल मैनेजमेंट हो रहा है, कमजोरी बढ़ती जा रही है, हालत उसकी खराब हो रही है, वो तो बाद में पता चलता है. तो जब वो बाद में पता चलता है तो कहते हैं डॉक्टर को डायलिसिस करा के आना होगा. सो दैट इज नॉट राइट ट्रीटमेंट. ठीक है, आप रीनल रिप्लेसमेंट थेरेपी दीजिए, पेशेंट को ठीक से डाइट दीजिए, पिलाइए और नॉर्मल रखिए. देन थर्ड थिंग कम्स द एनीमिया. एनीमिया इज पार्ट ऑफ एंटीस्पिरिन डिजीज. हीमोग्लोबिन भी कम होता है, धीरे धीरे कम होने लगता है, उसके लिए हम लोग बट एनीमिया इटसेल्फ कैन नॉट बी एब्सोल्यूट इंडिकेशन फॉर दैट. बट उसके लिए रेट्रोपाइटिन देते हैं, अगर आयरन की कमी है तो आयरन भी देते हैं. देन कम्स द रीनल ऑस्टियोट्रोफी, इसमें फास्फेट कम कर देंगे और आयरन डिफेक्ट देंगे. नाउ आई एम कमिंग टू द रीनल रिप्लेसमेंट थेरेपी. What is renal replacement therapy? Most of the time, it is recommended for end-stage renal disease, that is, either hemodialysis or peritoneal or CAP. Then, the most important therapy is kidney transplant. Kidney transplant is ideal, in which it is a total renal replacement. In dialysis, it is only partial renal replacement. Now, again, I would say that there is okay. Not all the patients with the CRF have got edema. So, जिसका पास कर रहा है उसको डायरेक्टिव देना भी मुनासिब है. हाँ, अगर एडिमा है तो डायरेक्टिव देते हैं. ठीक है. Then comes the hemodialysis. Now, what is hemodialysis? Hemodialysis भी जो है करीब not more than 50 years, 50 साल से पहले हेमोडायलिसिस नहीं था. उससे पहले पेरिटोनियल डायलिसिस होती थी अक्सर, और फिर वो हेमोडायलिसिस शुरू हुआ तो बहुत बड़े बड़े डायलाइजर हुआ करते हैं. If they are positive and we dialyze them, then machine can get infected as well as other patients get infected. Less likely that machine can infect, but more likely that filter which is being reused can have hazard to other patients. So the recent report of serology should be present. At the same time, in case there is an acute problem, so you dialyze the patient, throw away the filter, and disinfect the machine till you get the reports of HbA1c and MBC. HIV is not very common, so but anyhow, HIV is more than that. Especially those patients, foreign patients, Ethiopian and Nigerian, we are more concerned. So we check first HIV because they are more HIV classification than others. Most of the units in Delhi and NCR, they don't isolate the CV patient. But when I came from Australia, I was the first one to start isolating all the patients as CV. The reason is that hepatitis C doesn't have vaccination also, and it should be isolated. But if you don't isolate, the chances is that other patients will get infected, and you don't. The dialyzer should not be reused in a CV positive patient. Now, this is a very important question: that how many sessions of hemodialysis should be given? Ideal recommendation is that 12 to 15 hours of dialysis in a week, which means 4 hours dialysis 3 times a week, but 3 to 4 times a week. Though in US, 20 hours a week is recommended, but most of the patients again जैसे डायलिसिस से कमजोरी आ जाती है 2 to 3 times, तो यही समझौता हो रहा है, बट आइडिया जो है 3 to 4 times वीकली। Other substances you have to replace with isotretinoin by D3, calcium phosphate binder and erythropoietin. Now, just quickly, I think I'm taking a lot of time. So quickly I'll finish the dialysis patient. Dialysis unit should be open 24 hours because your own patient can come with a acute pulmonary edema. You never know. So one should be very careful. Other nephrologists should be looking after most of the dialysis patients. Now I will come with the hemodialysis with CAP. Peritoneal dialysis or chronic ambulatory peritoneal dialysis is as good as hemodialysis. I agree. But first choice should be hemodialysis if your patient can afford. The affording thing is that, afford by monetarily as well as morally. Sometimes what happens, you have to take the patient to the hospital, so physically cannot afford. The patient.
Now I am going to invite second lecture, invited lecture, Dr. Lali Fatmi from UK. The topic is role of Islamic hijab in prevention of sexual assault.
With your kind permission, I want to ask some questions. I want to have some discussion for the people, which has been presented by our honorable speaker earlier.
Maybe it can be done at the end of the session.
Yes.
So that everybody...
At that point of time, that these ones will be forgotten, neglected. Okay, sir. I'm Hakim Raisur-Rahman. I'm heading the department of Malaria, that is medicine. Okay. Number one, sir, you have said that in other system medicine, there is an extensive restriction of the protein. I think it's not true as far as immune system medicine is concerned. It's a blame on the immune system medicine. Rather, protein intake is the part of our treatment. We ask the patient of CRA to take dry foods, to take decoction of the kidney. This is the part of our treatment. So that you said that in other system medicine there is an extensive restriction of the protein. It's not true. Number one, sir. Number two, sir, I have been treating as a physician. I am also doing operating. I have been taking the patient of the CRA over the last 45 years. And what I have observed, the patients who are having serum creatinine level less than 5 milligrams, with our conventional treatment, they are getting better. Their blood urea comes normal, their serum creatinine level comes to normal, their HB level is raised, and the patient is better, of course, from all the angles. But of course, let me add also a shortcoming that if the creatinine level is more than 5 milligrams, 6 milligrams, 7 milligrams, we get fail. Of course, it is reduced partially, marginally. It comes to 5 or 4. Other general conditions patient is improving, but serum creatinine and blood urea, I have never seen a patient more than 5 milligrams of the creatinine touching to the normal limits. You said something, said patient should be sent for dialysis for much.
No. Look, C5 is calculated 740 minus 8, the GMR has to be around 20. Okay, so serum 25, there is no need for dialysis.
Sir, the patient who are earlier having prior to the treatment more than 5, there it comes to 4, 3, but it never touches normal.
Look what happened. The data was calculated for 5. So they may have chronic renal insufficiency.
Right.
CKD grade, maybe because of the infection or maybe because of UTI or some other things. Or drugs are responsible for that, like ACE inhibitor of the So those drugs will stop with infection creatinine will go down. And uncontrolled blood pressure. You check blood pressure. You control blood pressure. You control diabetes. It will come down. But I think it will not become normal. It can come to 2%.
The presentation that I've brought for you today is the role of hijab in preventing sexual abuse, assault and harassment. And I'll give a brief introduction about myself. I'm Dr. Lali Fatima, and I trained in this city as a gynecologist in All India Institute of Medical Sciences. And I'm working in London in a sexual assault center, which is called Haven. And the relevance of this topic, of course, especially in the months that we celebrate the birth and the death anniversary of Bibi Fatima Zahra Salamullahi Alaiha, who is sort of a role model in Islam and like the ideal lady to be followed. So I'm trying to correlate on one hand what is happening in the Western world because of unchecked behaviors and what the teachings of Islam are, and the consequences of these things which are very, very severe and which I see on day-to-day basis, and whether Islam is the solution to that. So coming to my next slide. Can I have the next slide, please? This is just a few definitions. I know you came through a very medicalized lecture just before that. Mine is more on a social theme. And I'll try to be brief. I'll just try to summarize. So these are the definitions. Because there are a wide array of definitions, I've chosen the ones from Wikipedia, which is a free encyclopedia available easily on the internet. And anybody can sort of have, just to have a consistency of things. And whereas it is described sexual assault and sexual harassment in different terms, I like the definition they've given about hijab. They say hijab refers to both the head covering and the traditionally worn dress by women and the modern Muslim styles of dressing. And then according to Islamic scholarship, hijab is given the wider meaning of modesty, privacy and morality. So this seems to be a very good definition of hijab to me. Can I have the next slide, please? So here are some sexual assault data. And obviously, because this is such a sensitive topic, and collection of data is very, very difficult. So most of the data that we have is from the Western countries. These are the data from the UK. And just to summarize it all, it says, basically it shows that there is a very high prevalence of sexual assault and rape. And it's not to say that it's only in the Western countries, it just might be that the reporting is more there. But then the lifestyle that is promoted in Western countries is more conducive to such things. So this is a study by Painter in 1991. And according to it, 1 in 4 women have experienced rape or attempted rape in UK. And then the most consistent finding is that it's not the strangers that are the rapists. It's mostly someone who is very closely associated to you, either a partner or a husband or a boyfriend, person who you are meeting on a regular basis. So this rape crisis of federation has come up with the data that 97% of the callers knew who were their assailants. So it's not stranger rapes that is prevalent, but more like somebody known to the person. And that is similarly confirmed by Kelly in 2005. The next slide, please. So, there are again another data, and if you look at the figures, you just realize how big a problem it is in the Western world. So they've estimated that 190,000 incidents of serious sexual assault, and out of which 47,000 is actually rape or attempted rape. And then they found that 80,000 women suffer rape every year. But the interesting one is the article from Amnesty International, in which it was sort of a survey given to people to answer the questions, and the general perception of the public was that wearing more revealing clothing was related to being sexually assaulted. So it says that the revealing clothing, at least 25% of the people thought that your clothes bore a relationship to being assaulted. And also your behavior, if you have multiple partners,